guys, this is Métis and Me, a podcast for Métis youth in Ontario where I dive a little deeper into what it means to be Métis in Ontario and the different intersections of Métis identity. I'm Hannah Bazinet, your host. Thank you so much for joining me. So Dr. Rebekah Jacques is a practicing forensic pathologist performing medico-legal and hospital post-mortem examinations and providing forensic pathology services to the Southwestern region of Ontario. She is an assistant professor at the University of Western Ontario's Department of Pathology and Laboratory Medicine. Her research activities focus on public health and the intersection between the medico-legal death investigation system and distinct populations, and she is currently in the process of developing a subspecialized area of ethics called Death Investigation Bioethics. Dr. Jacques has also recently been appointed to the Tri-Agency's Research Reference Group for the appropriate review of Indigenous research, where she provides advice and guidance on the development and implementation of culturally appropriate review approaches and practices for research conducted by and with First Nations, Inuit and Métis Peoples. So thank you for joining us, Rebekah.
Thank you for having me.
Would you like to talk a little bit about what you do? I know I tried to kind of come up with a synopsis, but I'm sure it's much more in-depth and complicated than I've made it out to be. So yeah, if you could just kind of talk about kind of what you do, your day-to-day, your interests, all that.
Sure. So as you mentioned, I'm a forensic pathologist, and my work is really what I call the academic trinity. So I do service, I do teaching and research. The service that I provide to the community is performing medical, legal, and hospital autopsies, which takes up the majority of my time. And the way that we look at autopsies is very similar to the way physicians look at medical problems. So when you go to your family doctor, you might have sore shoulder or some chief complaint. And so your family doctor will going to ask you questions about that. Okay, so when did it start? Is it both shoulders? What's the pain like? Does it radiate? Those types of questions. For me, my approach is the same way, except the history comes from other sources, come from the medical record, the coroner's warrant for postmortem examination. And from that, I'm starting to develop a differential of causes of death, just like the family doctor is developing a differential for why your shoulder is sore, right? Differential diagnosis. And then the next step, your family doctor might do a physical examination on you, right? So they might get you to lift up your arms. They might look to see if there's any loss of muscle in your shoulder, and then they'll compare it to the other shoulder. My physical examination is broken up into two parts. So it's the external examination. So it's a head-to-toe examination of the body. And we're looking for any diseases, any injuries, any congenital changes. And then the second step is the internal examination. And here I examine and weigh organs in the chest, the abdomen, pelvis, and I also look at the brain. And I'm looking for disease and injuries and congenital abnormalities here too. And as I'm working through these steps, I'm thinking, okay, why did this person die? Okay, well, they might have some heart disease. So they might have some plaques in their coronary arteries, or they might have pneumonia. So I test that against what I'm told at the first stage. Just like your family doctor is going to test their information they get from the physical exam to the history. And as I go through this process, I sort of whittle down on what could have caused this person's death. The fourth stage of the autopsy is ancillary investigations. So I might do some blood work. I might look at tissues under the microscope to help me confirm what I saw when I did my external and internal examination. Very much like your family doctor might do blood tests on you for your sore shoulder, they might do an X-ray. I might do this very similar investigations depending on what I've found in the previous steps. And then the final step is actually integrating those previous steps to come to a cause of death, much like your family doctor will do in terms of making a diagnosis about your shoulder pain. So that's there's a lot of mystery around the autopsy, but it's it is an objective process, and we are trying to find out, trying to discover why someone has died. So that's part of it. A smaller part is testifying in courts of law. In that capacity, I function as an expert witness, so that the criminal justice system can do their job. And my job is to tell the courts what has happened to the decedent. And in terms of research, a lot of my work is focused on creating this area called Death Investigation Bioethics, and for teaching and also doing some of the tri-agency work in kind of that domain. And then for teaching, we have learners from all levels. We have MLTs, or medical laboratory
Oh yeah.
technologists.
Yep.
Mhm. And we have undergraduate students, medical students, residents that rotate in the pathology department.
Oh wow.
Um, yeah, and so there's a lot of teaching that goes um, through that process. And sometimes I have new police officers
Really?
for the first time. Yeah, I'll teach the steps. Exactly what I've told you about the steps of the autopsy.
Yeah.
So yeah, we have learners at all levels.
Wow, that's awesome. So you work a lot with like the more forensic side, or are you doing kind of your run of the mill autopsy of people that have died in the hospitals? Are you doing both?
Most of my work is the medical legal autopsy. So those are typically what we call sudden unexpected deaths, typically occurring in the community. But sometimes it can be people that died in hospital, and there might be some medical legal questions that need to be answered through the autopsy. A small part of what I do is hospital autopsies, and the difference between the medical legal autopsy and the hospital autopsy primarily is that with the medical legal autopsy, the authorization comes through the coroner's warrant for postmortem examination. So we don't elicit authorization from family members. Where the hospital autopsy, the next of kin is approached by the clinical team, or sometimes families will approach their loved one's family doctor that was treating them in the hospital, and ask for an autopsy. And so some things can only be answered through the autopsy, and it's always great to help families, because the autopsy, finding those information, can help assuage grief or help with the grieving process. And so that's really a community service that we have here at London.
Yeah, that's awesome. It's really interesting to hear you talk about it because, like, the forensic pathology route is one of the ones that I'm looking at if I do get into medical school. It's something that's always kind of piqued my interest, but I've always thought that, like, I have glamorized it a little bit more in my head because I am more interested in that stream just because of the forensic and, like, true crime kind of side of things. So it's interesting to just hear about what you would be doing when you're not doing that part of the job. Yeah, that's awesome.
But it's a rewarding career. It's really, I still sometimes meet with families for hospital autopsies
Yeah,
and medical legal autopsies. Um, and um, and so you still, some people are worried that they don't have the patient interaction, but you can still
right.
have that. And you have to be a really curious person and like detective work. So a lot of those things that are glamorized about forensic pathology are true.
Okay.
But the part of me doing it in high heels is not true.
Yeah.
I got to wear my
Yeah.
personal protective equipment, and I don't think
Sometimes when
heels.
you see things, you're like, you just shake your head. Even me not knowing much about the field, I'm like, that's not how it's done in real life. My favorite is when I think it's usually like the quote unquote coroner that shows up to the crime scene in those shows, and they are not wearing gloves and they're touching evidence and they're just shouting time of death. I'm like, I feel like there's more to it than that.
Yeah, time of death is one of those tricky things. I mean, we've been able to have people go to the moon, and now we're even thinking about we have machines going to Mars, but
Yeah.
scientifically determining time of death is there's too many variables
Yeah.
to be really accurate. So
Yeah.
they do get that wrong. I wish we could do that.
Yeah.
If we can find a way to do that, that would be, you know,
The big jump.
totally, it would be huge in
Yeah.
forensic pathology. And maybe that's what you'll discover, Hannah.
Yeah, maybe. One day. That's the dream. All right, well, we'll jump into question one. So how has your journey of exploring your culture and Indigenous identity or indigeneity unfolded through your life?
I think I can describe my journey of exploring my culture and Indigenous identity to be, simply put, as actually very complex and challenging. Um, it was something I was taught at a very young age, that I was Indigenous, but I was also taught to be ashamed of it. And shame is a really sticky emotion. Today, I would describe myself as I have so much gratitude to my culture, and it has taught me how to live an authentic life as an Indigenous woman, as a Métis woman. But like many Indigenous people, I too have faced criticisms and challenges because I am Métis. Probably the most harmful lesson is that Canadian society has taught me about being Indigenous at a very young age, that it was shameful to be Indigenous. And all the attributes of one's identity, I found this one the most sticky feeling. Um, and what I mean by sticky is that this feeling can cling to you, and it can be sometimes feels impossible to get off yourself. And you need help. So if you think of, you have, maybe you've eaten ice cream and it's sticky, you can't like get that off yourself. You need help, right? You just can't use your fingers to take it off. So it took me a really long time to do this. And I credit this to my culture and community that has removed this stickiness so that I can be free of it. So they're sort of like the soap that has washed it off for me. And so now, where there was shame, there is pride.
Yeah, that's awesome. And when did you find that that began to change for you? Were you in your teens or were you in your undergrad or?
Um, Maybe a few years ago.
Oh, wow. Okay.
Took a long time.
Wow.
It's when I mean sticky.
Yeah. No, yeah.
you know, it's common. It's not just Métis people.
Yeah.
I have a lot of friends that are First
Mm-hmm.
Nations, and really echoing the same thing.
Yeah.
And I was at this missing and murdered Indigenous women and girls session on Six Nations a few years ago, before like at the beginning part of the inquiry, and people were saying the same thing, and it just resonated with me. I'm like, that's shared because it's been taught to us. But you know um as what we learned from the Truth and Reconciliation, what education got us in this mess, education can get us out of it too. So you can unlearn it. It might take a long time, but you can unlearn it.
Yeah. That's amazing. That's an amazing way to look at it too. So you did well based on your answer for the last question. This one you might not have an answer for the whole question, but what role did your Indigenous identity play in picking your career path, and how does it affect the evolution of your career?
Okay, so I'll start with the first question.
Okay.
Um, so I think the important thing is that representation plays a huge role in your career selection.
Yeah.
There were certainly no Indigenous physicians that I knew of growing up. So despite having attributes of a physician, you know, being strong academically, hard worker, kind, um, all attributes that you generally society thinks of physicians, it seemed for me to be a physician was impossible.
Mm.
In particular, in high school, I decided that I wanted to be a forensic pathologist. And now I know I'm dating myself here a little bit,
Yeah.
but there was no CSI. There's no huge TV show
Oh, okay.
before at that time. And then
Yeah.
after was Quincy, which was also a hit TV show, I think about a medical examiner.
Oh, I've not seen that one.
Yeah, it's so I kind of fell between the two. And so I didn't have any point of reference on how to become a forensic pathologist. I do believe that I read about becoming a forensic pathologist at my local library.
Mm.
And so I I learned that to be a forensic pathologist through my research, you had to be a doctor. So I had these two competing issues, right? Indigenous people aren't doctors, therefore I can't be a doctor. And then two, I want to be a forensic pathologist. So therein lies the tension. So after completing my undergraduate degree, I still didn't want to be anything else other than a forensic pathologist. So I applied, and really, for the first year of medical school that I got in, I was walking around still thinking I didn't belong here. Like they made a mistake, but I'm not going to tell
Yeah.
anyone. So yeah, because it's just ingrained in you, right?
Yep.
So
Yeah, if I don't say anything, they won't notice.
and then yeah, exactly. How does it affect the evolution of my career? I think now in my career, with missing and murdered Indigenous women and girls, there's definitely an obvious role for forensic pathologists that can play, especially a forensic pathologist that also happens to be an Indigenous woman.
Yeah. Yeah, no, that's amazing. And that's the first thing I thought about when I was reading through kind of your bios online was that there's definitely this huge need for representation of Indigenous women at those in those conversations around, forensics right now because of the big conversation of missing and murdered Indigenous women. So it's really interesting to know that, you know, your voice is being heard in that conversation. And
Where are you reading all my bio?
it was on the London Health Sciences websites. There's all these blurbs that I was like picking apart.
That's so funny.
Yeah.
Because I just wonder, I had this young young fellow from the States, I think it was North Carolina, and he emailed me because he wanted to do research with a forensic pathologist for his high school project.
Okay.
And I mean, I had to politely decline, but I'm like, how did this fellow find?
That's so funny. Yeah, your name's if you just Google your name, you're all over the place.
Oh, I heard that's a bad thing to do because
Yeah.
you might.
Yeah, and I just think about it too much, right?
Okay, mystery solved.
Yeah.
Okay, that's all where he found me.
All right. Okay, so next question is, did you face any barriers or conflicts in your medical education due to your indigeneity?
Well, I think you could probably break it down into two parts. One is the internal barriers, as we just discussed about representation. But there's also structural barriers for Indigenous medical students. So you have to know that medical school is a social cultural construct of values that are embedded in the curriculum, both overtly and hidden. So there's this term called hidden curriculum. And these all tell you of what it is to be a physician, right? So, things that you learn, well, you have to be able to sacrifice, which is true. But it will also give you other ideas of what it is to be a physician. So there's that. And then on top of it, medical school, like many public institutions, do reflect dominant societal interests, and often have systems and practices that maintain and reproduce the situation, and they have privileges infused within it. So this sometimes is referred to as medical colonialism. So educational institutions will validate and legitimize which are knowledges to the exclusion of indigenous knowledge, right? So indigenous knowledge is not legitimate, it's not valid. So there are structural ways institutions would invalidate indigenous knowledge or ways of knowing. So as an indigenous student, you have this inherent conflict that signals that your knowledge and your ways of knowing are not valid and therefore not scientific and therefore wouldn't make you a good physician. So those are just intrinsic in the structure. So the structure over time has to change to validate other forms of knowledge. I always hear a lot of elders say, they'll read some article in published a scientific article, and they'll be like, well, not elders, but like other colleagues, and they'll be like, elders have been saying that for,
Yeah.
you know, all time.
Yeah.
One day science will prove what elders have been saying for all
Yeah.
time.
Yeah.
So, yeah, and there's truth to that. There's
Yep.
totally truth to that. So,
100%. 100%.
yeah.
Well, that kind of leads into the next question. So, like, how does your indigeneity affect the way you show up, both like in medicine, but also in your kind of forensic spaces?
I think my indigeneity affects the way I show up in forensic spaces, particularly as a forensic pathologist. I think it makes me a better forensic pathologist because it adds the dimension of being culturally aware of issues that the medical legal death investigation has for Indigenous peoples and their communities. I'm keenly aware that there's also a high probability that myself as an Indigenous woman have a 12 times, chance of being murdered or missing other than other women in Canada. So, that's always, that I always think of that when I do a case that creates that, you know, remembrance of that. And this is why I talk to a lot of families following autopsies. A lot of them are Indigenous families, and I always make myself available because I really understand where they are from that perspective and help with knowledge translation of this complex thing called the death investigation system. And when people go through healthcare, um, they they get an idea of what to expect, right? Because most people go see their family doctor. They might have to go to emerge once in a while, so you kind of are a repeat customer. In death investigation, ideally, you're not a family member that is a repeat customer, and so you might not necessarily know how to navigate the system. So that's one thing that I can offer for them.
Yeah, that's good. And I feel like there also might be this um not bias, but I guess internal bias where there's not this understanding that you need to sit down and have those conversations. So your indigeneity kind of, I guess, not lessens the ego, but allows you to have those, like, drop the guards and have those conversations with the family, be able to communicate properly. Because I've even understood that that's the issue, not just with pathology or forensic pathology, but in medicine in general, where sometimes um, doctors don't want to sit down and think about how to explain the situation from in a way that is understandable to all, like, education levels or societal levels or what have you. So I feel like it would be easy, especially with forensic pathology. You're kind of at the end of the road, so there might not, in your not in your mind, but in a forensic pathologist's mind, they could say, it's done, so we don't need to sit down and explain every little detail to the family. So it's good that your indigeneity makes you kind of be able to have those conversations with the family and sit down and explain what they need to be explained and talk through what they need to be talked through.
Yeah, and I think particularly a couple of things for death investigation and then pathologies in general. So I think that we need to, as a system, make bridges with Indigenous communities in two ways. So one, I do in crisis. So when someone's family member dies, that's crisis for that family, right? Like that's unimaginable what they're going through. But the other place that we have to work on to build trust is what I call in times of calm. So we need to go to these communities and talk about what we do, right? To remove the mystery, so that if they happen to go in crisis, they have an idea of what might be before them. Then the other issue too is that there have been ethical oversights in pathology, right? There was the organ retention, for example, brains and hearts that originally occurred, what was routine pathology practice. And then there was an inquiry in the United Kingdom about this practice where families didn't explicitly know or didn't explicitly authorize it in hospital autopsies. And so, a lot of families may feel that they don't have trust in the system. And so we have a lot of work to do to build that trust. Part of the reason was not informing families is because we didn't want to upset them more. So you can imagine if someone
Right.
just lost a
Yeah.
loved one and then you're bringing up, oh, well, can we keep his heart?
Yeah.
You
Yeah.
know?
There's a balance there for sure.
Yeah.
Yeah.
So that's changed. Society has changed too. They're more interested in knowing about certain parts of the autopsy. And so that's where you have to build in calm.
Right.
And so some things that I do kind of from more from a medical perspective is that I've gone to Walpole Island, for example, and talked about some cancer pathology and how we treat people's tissues and we treat them with respect. And, if say you had a leg that was amputated because you had a complication of diabetes and you want that back for your own burial purposes, there's a process that you can go through. So I think in terms of, respect for tissues that align with community values, that's part of the death investigation bioethics, but also pathology ethics. But the part of the problem too is a lot of people don't know about pathologists. They think if they have a lesion in their breast, they take a little sample of tissue and it goes in a machine to diagnose breast cancer or not breast cancer. But that's actually a physician, a pathologist that reads that tissue and they interpret the pattern in the tissue to say, yes, this is cancer, or no, it's not cancer. And really, a patient doesn't have cancer until a pathologist says you have cancer.
Right. Yeah. Yeah.
You'd have a hard time finding someone that's going to do breast surgery on you and chemotherapy and radiation if a pathologist doesn't say that you have breast cancer. So it gives part of that is a trust relationship between the pathologists and the treating physicians. Um, but it is a physician that makes that interpretation, and most people don't know about us. Um, so that's part of the outreach of informing people.
Yeah, no, yeah. I feel like it's definitely one of those fields that's not only misunderstood, but like you said, nobody really knows what's going on kind of behind the black curtain, right? So that's good that you're having those conversations. All right, so what do you believe to be the largest benefit of being an Indigenous female voice in forensic spaces? And that probably you've already kind of answered that question a bit, but if you wanted to elaborate a little bit more.
I believe the largest benefit of being an Indigenous female voice in forensic spaces is the ability to offer a lens that is different from the dominant perspective. So, for example, ingrained as Indigenous culture is respect for elders, who are typically respected seniors in our community that guide us, typically spiritually and personally. And that respect for elders really transferred for seniors too. And this has strongly influenced my interests in death investigations in the elderly. So that resulted in me writing a chapter on the elderly. And I've also created autopsy guidelines for how we conduct autopsies on the elderly.
Wow, that's amazing.
Thanks. But I think it's because of I think it's that respect and there is ageism in this in society and you know seniors are kind of pushed to the side. But as from an Indigenous person and a Métis woman, elders were
Yeah.
most
Yeah.
you held so much respect.
Yeah.
And so I'm like, why are they pushing all these important
Yeah.
people?
Yeah.
And I think for a long time it's been neglected in, especially in death investigation.
Yeah. Yeah, I think a lot of times in colonial spaces, the voice of the elderly is not only ignored, but kind of like laughed at, which, that's I could see how that would become a huge issue in your field. So yeah, that's great. All right, so the next two questions are a little bit more Métis focused. So, how do you believe the Métis voice to be unique in conversations about cultural competence surrounding research ethics? So, this question kind of came from me seeing about your work with the tri-agency and kind of research regulations. So, yeah, that's kind of where that question was coming from. So,
I think Indigenous research, you know, with Métis people, with other Indigenous people, we have a lot of shared barriers and lived experience. But but Indigenous peoples in general are a very diverse, heterogeneous group,
yes.
and Métis people are no exception under the umbrella of Indigenous people. Right?
Yeah.
We have our own culture, our own language, and that we have to ensure that research capacity um, understands researchers understand the differences of Métis is different from Mohawk
Right.
or Algonquin,
Yeah.
and so they need to understand that. So one, they can do relationship building with our community, and two, that they can avoid harm or any of the risk of harm to our group.
Yeah.
So that's basically what I do at the tri-agency is provide that Métis lens.
Wow. That's awesome. Yeah, because even I've gone to a couple conferences in my undergraduate degree that were kind of, academic or healthcare focused. And a lot of the conversations that we were having, because they were pan Indigenous, was kind of also about how, the treatment of Indigenous people with that kind of coating us all with the same brush actually not only affects our ability to kind of communicate and have dialogue with the colonial system, but it also affects our relationships internally and creates like animosity and all sorts of stuff. So yeah, I just thought that was super interesting that that you were having a voice at that table. That's really great.
Yeah, I'm so grateful to be able to be part of that table, and um, so many amazing people that sit at that table that I learn from every time we meet. So it's
Yeah,
such an honor.
that's awesome. All right, so the last big question, I have a couple lightning round ones after this, but the last big one is what advice would you give other young Métis students who are considering pursuing medicine?
I think you need to know what you're getting yourself into for sure. So there's lots of different careers that you can do, and your life as a career is a series of jobs. And medicine is definitely rewarding and fulfilling, but it is a commitment. So the way it works is you apply to you get an undergraduate degree. Typically, it's 4 years now at this level. And if you're someone that is more of a late bloomer, you started or you stopped, um, you can still apply. It's not necessarily limited on age, but experience can really speak loudly. But typically, it's a 4 year undergraduate degree, and largely based in the sciences for most of the medical schools. So you need to know about chemistry and biology. But having extra courses in humanities is also an asset because it'll help you write those letters to get into medical school. And during that time, you want to demonstrate that you have the attributes of a physician because you'll need to participate in things and demonstrate that you do have leadership skills. We're not expecting people to find the cure for cancer, right? We just want you to demonstrate that you have the attributes of a physician
Yeah.
and having some experience with physicians to get an idea of what you're getting yourself into. And then most schools require you to do this MCAT. It's an exam that I think it's all day and it's very expensive. So usually you study during the summer and write it at the end of the summer. And when you apply to medical school, they want your transcript. So you have to demonstrate that you are bright, right? You can manage complex physiologies because your patients are going to depend on you. And if you go through Indigenous streams, typically you have to have a letter from community demonstrating your relationship to community, and also some sort of identification showing your relationship. So if you're a member of Métis Nation of Ontario, you would uh, take a picture of your card, for example. Then you apply to medical school, and the next step is seeing if you get an interview. And every medical school has a different way of doing their medical school interviews. Some places do a panel, some do multiple mini interviews.
Yeah, that's what I
Um,
did.
yeah,
Yeah.
and awesome.
Yeah.
And so really practice and prepare for that. And if you're applying as an Indigenous candidate, it makes sense to talk about being an Indigenous person and your community. And I should also go back a step. There is in Ontario, there's this website called ALMSAS where you submit everything to this centralized station. And sometimes they want you to do autobiographical letters, and there's different requirements where that's not really centralized in other provinces. So that's the advantage of applying in Ontario.
Mm.
And then there'll be a set date where they have to release the acceptances. So typically it will happen as you might get a letter for acceptance, rejection, or you might be on a waiting list. And you might find out sometime in the summer if you get accepted. And then once you go into medical school, most medical schools are 4 years. McMaster is a 3-year program, and now one of the medical school, I believe in Alberta, I think Calgary,
Okay.
it's 3 years. Um, and and so you have to decide in those 3 years what specialty you want to
Right.
do. Do you want to be family medicine? And most medical schools are, with some exceptions, divide the first half of medical school as mostly in class type learning. So you'll learn about how to interpret EKGs, which are electrocardiograms, and other skills that you'll need to be a physician.
Okay.
And then usually the second 2 years are the clinical years. So you'll have a new name. You'll be called a clerk, and
Ooh.
you'll rotate through different services during those 2 years. And then you can also do electives. So if you're really interested in pathology or surgery, you can do electives at
Okay.
other medical schools. Hopefully, there's no pandemic to allow it.
Yeah.
And then during that time, you are thinking about your specialties. You're going to test the waters and think about, what kind of physician do you want to be? Do you want to be a family doctor or pathologist? So if you want to be a family doctor, all programs after medical school, you do a residency, and they can range from 2 to 5 years. If you want to be a family doctor, that's 2 years. If you want to be a pathologist, that's 5 years. Um, if you want to be internist, I think that's 3 years. Pediatrics, I think, is 4 years. And then a lot of people do a fellowship after that, and that can be usually 1 to 2 years.
Is that like shadowing, kind of?
It's kind of more like an apprenticeship in a
Okay.
way. So you are fully qualified doctor, and you're just learning a subspecialized area of medicine. So when people come into academic hospitals as patients, they may see anyone from a medical student to a resident to a fellow, all the way to a staff physician like myself.
Mm.
The gift that we get from our patients is knowledge, right? The
Yeah.
patients teach us a lot. And so we're grateful for that gift.
Yeah.
So that's how it is.
It's
Yeah.
a long journey.
It's a long journey.
Yeah.
That's what I mean. You have to know what you're in for,
Yeah.
because but it's rewarding. Like, the other thing too is medicine has so many areas that you'll find something that will interest you. And it's really rewarding job. And you, like anything, you have to have some balance. You need to take time for yourself and follow one of the 7 grandfather teachers of teachings with love, like have self-love and self-care.
Yeah.
So those grandfather teachings are useful in medicine.
Yeah, return back to those for sure.
Mhm.
Yeah, no, that's good. And I hope that people that are listening who are thinking about it, it piques their interest maybe. Because I know that when I came into my undergrad, I wanted to do medicine, but then I got into my undergrad and medicine started to look a lot more scary and a lot more like a bit of a black box. So that's why I got scared off for a couple years, and now I'm back at it. So maybe that'll take the edge off for somebody else. All right, so the last couple questions, they're just meant to be like quick little lightning round questions that I'm asking every guest. Um, so yeah, you can just kind of give whatever comes off the head. They're supposed to be fun. So the first one is, what does being Métis mean to you?
Well, it's weird because the first notion was like that. Well, that's just my identity. But I think it's being a proud Indigenous person that honors my ancestors that birthed a new nation on Turtle Island following contact.
Yeah,
And then to continue to love and respect my culture and community and the members of my community.
yeah, I love that. I love that. All right, and the second one is, what is your favorite part about being Métis?
My favorite part about being Métis. Um, these are fun but challenging.
Yeah.
Um, I think my favorite part about being Métis is my culture. Go back to that, they took the stickiness off.
Yeah.
And I mean, we have some darn good food, and the Michif
Yep.
language is pretty amazing.
Yeah.
Um, and also, the fiddle, like
The
music.
fiddle.
Yeah,
Yeah. Yeah. You can't help but move, right? Even if you can't move, you still do.
exactly.
Yeah.
There's not, when you say favorite, it sounds like it's one thing, but there's not many things. But
Yeah.
yeah,
Yeah. I know community is definitely a big one for me too. I kind of had the same experience a little bit earlier in life, but where I was unsure, and what really helped me dive in and start to really appreciate being Métis and being Indigenous was my community as well. They just kind of like help you feel good about it, you know?
yeah.
Yeah, yeah. Well, that's all the questions that I had. So thank you so much. This has been awesome. I've been really excited to pick your brain because, like I've been saying multiple times, your career is super interesting to me. So yeah, this has been a lot of fun for me, and I'm hoping that everybody else that's listening will get something from it too. So thank you so much.
No problem. And anyone who is going to be another book on Hannah's podcast, I highly recommend doing it. It's fun. It's easy, even for an old timer like me. And thanks for having me as a guest, Hannah.
Yeah, thank you so much. This podcast is done in partnership with the Métis Nation of Ontario's Youth Council and their Grassroots Grants program, which is a program that funds Métis youth in Ontario to start their own community-based initiatives. If you liked this episode, please feel free to follow me on Instagram at Métis and Me with 2 E's, on YouTube at Métis and Me with 1 E, and you can also email me at métisandme20@gmail.com. Thank you so much for listening.